Hey, today I just want to shoot a quick video about marketing of sales of a service. You're marketing, if you're a dentist, entrepreneur dentist, if you're marketing anything, it's actually a service because we don't sell products. I mean, a few things that dentists make. My practices don't sell product, we sell service. And if you're selling service, then you're basically selling yourself. You're selling people on the idea of trust. Trust me. And in order to do that, you use a lot of auxiliaries. You know, we have front desk staff, we have managers, we have back office staff, different doctors, sometimes associates. Everyone needs to be trained. Everyone needs to be trained on what to say, how to say it. You cannot leave it up to just random thinking and think that someone just intuitively knows what to say and how to say it, and it's going to come out right every time. So anytime you're a professional, you have to script. You want them to say it this way because why? Because you want predictability. If you are going to have set any kind of expectation and expect some kind of predictable results, you have to know what is said every time, and it has to have already been tested. Most of the time there's what they're called best practices out there. So if you're using best practices, it's something that's already been tested, but you must use those kinds of things. Now, for us, the thing that we are really selling, once you're in the office, there's a thing where the doctors are selling, but as far as the staff, so forth, basically what we're trying to sell is the opportunity to serve their families and friends. So we really want referrals. So here's the thing. If there's an old saying, say a person could die of thirst in the midst of water. Why? Because you didn't ask for it. There's water right there in the next room over, but you never asked for water. You didn't say, I'm thirsty, I want water. So we didn't offer you any water. But if you had asked for it, hell yeah, we'd give you some. So the way you want to do it, though, people tend to do favors for people that they like, people that they know. So what we want to do is establish a protocol of getting to know the person, saying certain things that are complimentary, things that they like. And especially doing pediatrics, you want to compliment their kids. You want to rehearse their name over and over again so that they know that you know them. It doesn't matter that they know you. You want them to know that you know them and that you memorize their name. So there's all kinds of ways before you go out and get the patient, look at the name, look at the history, and try to come up with something. Do they have a pet? All of those things you could find out, and you could talk about that, start some general conversations, because at the end, what you want to do is use them as emissaries to go out and get their families and friends. I was talking this morning in my group about setting anchors. And an anchor is something that once a person, it comes into their mind, it triggers the thought. Just say, for instance, you want someone to refer their families and friends. So the way I was taught to do it is say, Shirley, I'm so happy that you're here and you brought your kids. What did you think of the service? And if they're saying, well, I really like it and I like what you're doing, tell me if you'll do this for me. Do me a huge favor. Would you, and you pause. The pause is to let them think, damn, he's going to ask me something like money. Most of the time when they hear, do me a huge favor, you want to borrow money. And you say, no, I don't want to borrow money. What I would like is this. Do you have family or friends or neighbors that you think might be able to use this type of service? Now you've given them three different things: family, friends, neighbors, or even enemies. And you kind of give it a little chuckle. And then you say, and if it's enemy, you make sure you let me know. But can you recommend us to your circle, your inner circle, maybe online, or maybe when you see them? And now, because they're already busy going through their lives, doing the different things, they got to stop at the grocery store, they got to pick up another child or whatever. But when they run across their family or friends that have kids, it triggers in their mind, boom. The doctor asked me to recommend, oh, we were at the dentist today. These guys should check it out. Or you send something online when they're online and they're thinking about it. But you have to set those triggers in their mind. And then when it happens, they'll go ahead and do it. Now, to follow through is this. When they do call, You have to make sure that there's no kind of obstacles in the way of the calls and so forth getting through, because you've generated a lead. Now you have to do lead conversion. And then you have to do some follow through to make sure that they are seen in the fulfillment of whatever it is that you're selling. And like I said, we're only selling services. So the main thing is generate a lead and the thing, you can pay a lot for ads and so forth, but there's nothing like a referral. A referral is this. It's someone that's a friend or somebody that they trust telling them to go. Just like you and I. If we get a referral from somebody that we know and trust, then we're more likely to go there than something that we just saw online or out of the, whatever. You always want to go on building these leads based on referrals. And referrals, it takes some thinking. What are all of the different things that you could do along the way that could push a person in the direction of acting as an emissary for you to go out and make these things happen? If you can find that and say the right things, ask every time. But remember this, if you don't ask, you don't get. You must ask, and ask over and over again, and get better at asking, and until you have people working out there for you. And then when they come in, you're asking them, and I've done this many of times. I said, we're trying to build a practice. Let me ask you something. You're back. Have you sent anybody yet? Have you referred any of your family, any of your friends? I remember I asked you. And a lot of times, yes, I sent, so I sent this one, I sent that one. That's the kind of thing that works. And you build a practice around that, you're really everything. And we're on stage. Once we get a chance, you go out, you know your script, you know what you're going to say. And then as soon as the doors open, boom, you're on stage. Hi, how are you doing? Blah, blah, blah. You have to have that. It has to be genuine, but you have to have it rehearsed so that the script is said over and over again. But more importantly, you have to make sure that all of your staff and your managers are trained to do it. And you can't train them once and think that they're going to do it. It's an over and over repetitive thing. You have to do it enough so that they don't have to really think about it. Now it's time. But you do have to monitor. You have to monitor, because you could have people, you've gone through this thing of how to answer the phone, how to greet the patients and so forth. But you walk in or you call and they're all off script. And that's not the way we do it. We didn't train like that. Now you have to do what is called corrective action. You have to get them back on, or course correction. A course correction is another name for corrective action. And the corrective action can be verbal, but you document that it was verbal, or it could be written, a corrective action notice, a CAN. So you have to have those, because unless there's some consequences, they're going to do exactly what they normally do at home or whatever. They answer the phone and then hold the line, please. That's not what we say, and that's not how we were taught. And then the greeting and how they pass the patient along, everything has to be scripted. That's my major point today. Remember that. If it's scripted and they practice and rehearse it and you give them time and you put the expectation and let them know, they will do it. Make sure that you inspect what you expect.